Päällä nyt. Nyt on päällä. Toimii.
All right, so good afternoon, everyone, and warmly welcome to this roundtable on economy of well-being. I suppose you can hear my voice without the microphone, but I'm using the microphone because the whole session will be also live streamed. So because of that, also the one who are following the in internet can hear what we are speaking here. So many of you have today participated the conference on economy of well-being. Not all of you, but I suppose this created perhaps some thinking what to do and also thinking what to do in the future with this concept. My name is Taru Koivisto. I'm a director working here in Finland in the Ministry of Social Affairs and Health, Department for Wellbeing and Health. Our idea behind this session was to use the opportunity while we have a conference here in Helsinki to gather together experts which could be in a way somehow promoting also the future of economy of well-being. What to do, how to do, what tools we have and what kind of ways we could have for the implementation of this approach. And aim here today is to discuss and share what kind of experiences we already have, what kind of mechanisms there are, and also try to somehow find a common understanding how to proceed, what to do together, and what ways there are for future. And purpose of this meeting is also to have an opportunity to share views, to discuss, share your experiences, and not just listen to excellent presentations, but have an opportunity to discuss and share your experiences and your knowledge, so that we together can take forward this approach. Just shortly, I think it could be useful to go through what we mean by economy of well-being. I know for many of you it's very familiar, but just shortly a summary what was during today and yesterday opened very much in the conference. So we want to emphasize the economic growth and people's well-being as approaches which should be in a balanced way taken into account. And it means that we need a horizontal approach which puts people and their well-being at the center of policy and decision making. And for EU, it's really important for the economic growth, productivity, long-term fiscal sustainability, and also societal stability. So all these perspectives can be promoted by this approach. And also in EU, as you all know, this is a key aim of treaty and also Charter on Fundamental Rights of the EU. So also take this perspective into account. And economy of well-being, it covers, of course, physical and mental health, but also employment, social protection, skills and education, and also general equality and occupational health and safety, these approaches. And there it's essential that we work together in collaboration with the different sectors. We have taken as examples here during this EU presidency what the economy of well-being could cover. We have been taken examples from mental health, health security, nutrition, and also prevention in general and gender equality. So these like to open what we mean by and how we can in practice implement this economy of well-being approach. And one more issue to mention is the European semester, which is an important tool with which we can better promote well-being of the people if developed further. So that we in the future could have better cross-sectoral coordination and also horizontal analysis as part of a semester process. so that the approach would be more balanced. So, and we need there a paradigm shift, I think so. And we are just now preparing council conclusions on economic well-being, which is discussed in the working groups of the EU. And next meeting will be next week, and so we'll have actually already got rather much support from member states of the EU for this approach. People are looking forward to have a new way of thinking and have a balanced approach for well-being of people. So that's about the concept. Today, we have an opportunity to hear some presentations, introduction to different aspects of economic well-being. Three presentations, and after that we have 2 panel discussions on the issue. And as I said in the beginning, really look forward to get also your input for this day. Not just listen to the presentations, but together also share what you have experienced, and what your knowledge is, and what we could do together for the future. So, and after, one more practical issue. After the roundtable, we have an opportunity to share together also more informal issues. We have some refreshments there after this. So something also more not so official part of the program. But going to the agenda of today. First, as I said, we have 3 presentations, so introduction to this issue, different aspects. And first, we have Associate Professor David McDade, who is working in the London School of Economics and Political Science. And he has really vast experience on research, publications, etc., related to different aspects of economics, of policy, of mental health and public health. And from that perspective, we'll now hear her views. His views. Sorry.
Kiitos, thank you. Right, so good afternoon, everyone. I'm going to make sure I stand somewhere so I don't block the screen. And do I have to press forward on the keyboard? I guess I do for this presentation. That's perfectly fine. Wellbeing Helsinki, that's the one. Just hopefully it works. Otherwise my well-being is diminished. Okay. Brilliant. I'm fine actually. Am I speaking enough into the microphone for the recording? Good. Yes, perfect, thank you. Okay, so in the very short time I've got, I'm going to go through a few points about well-being and its measurement, particularly from a policy perspective. So I think my colleagues later on will talk more about some of the specific measures. I'm not going to really focus on that, but simply the point I want to try and make, we might have perfect measures of well-being. Let's assume we have perfect measures, but a key thing then is how we actually use those measures. Do we use those simply to say this is the state of well-being in country X, Y, or Z, or are we looking to see what impact changes in well-being have on other outcomes that are of interest to our nations, and the other way around as well, whether, for instance, improvements in health are associated with improvements in well-being. I mean, you might think that's an obvious thing, but the point is how we use this is going to be vitally important. And I thought I'd start actually by taking a quote here, and I will read it. It says, since there is now increasing evidence of the deterioration, particularly in living nature, the entire outlook and methodology of economics has been called into question. The study of economics is too narrow and too fragmentary to lead to valid insights unless complemented and completed by a study of meta-economics. And this may sound like a quote from somebody thinking now about how to change and to think differently about the way in which we think about economics and the role of economics. But this was actually published by a chap called Schumacher back in 1973 in an economic textbook called Small is Beautiful. Now, Small is Beautiful is not one that probably that many people have heard of, and Schumacher was talking about something which he'd coined as Buddhist economics. And I wouldn't call myself a Buddhist economist, certainly not, but I think there's a point there that Schumacher was making, and indeed this is not long after Robert Kennedy was talking about different alternatives to GDP as something that society should measure, but thinking differently about how we actually measure economic performance and growth and outcomes and things that countries and nations wish to attain. So even then, Schumacher was thinking about the environment, sustainability, actually trading off growth for other aspects of life that we may consider to be more important to our well-being. So I just thought I'd mention that. Everyone probably in this room knows what we mean sort of by the economy of well-being. But I think it's just to emphasize from my point of view, you know, it doesn't necessarily have to be a trade-off between economic growth and well-being. They are inextricably linked. Sometimes they're contested against each other, but many things will work in the same direction. We know that, and we've heard at the conference, and we know from the work of the Finnish presidency, the emphasis on trying to think about well-being across many different sectors. Some of them mentioned on the slide, but it's not just about sectors, it's about really our way of life and thinking about climate change, the environment, tackling long-held prejudices, both around gender inequalities, perhaps racism as well, all those kinds of things. But it also means that from an economic point of view, and when we're thinking about measuring well-being, it means that we have to challenge ourselves to find adequate and appropriate ways of measuring things that, from an economic perspective, are sometimes difficult to measure. Not everything can easily be measured in a monetary terms, and that, for rightly or wrongly, has been one of the key metrics that's been used by governments to determine investment strategies over many decades. And I think it's also worth saying that, go forward a slide. It's also about fundamentally, in my view, seeing well-being as an investment rather than a cost. But to do that, I would argue quite strongly, we need to demonstrate, or it's helpful to demonstrate, that well-being itself, actually investing in well-being leads to outcomes that society think are worth achieving. Whether that be better capacity in individuals or in the population to deal with the challenges of the 21st century, whether it be a greener environments that we leave for our children and our grandchildren, all these kinds of things, better health. I mean, for years, my colleague Joseph Figueres has always been talking about health as wealth and well-being as wealth as well, I think. And you know, it's also really thinking very much about these kinds of issues. Investment, not a cost. I'm not going to go through all the evidence around well-being, but the evidence needs to increase. But nonetheless, absolutely, we can say things. We know from many studies that better well-being is actually associated with better health and certainly better life expectancy. But of course, it's important to have high-quality, healthy life expectancy. And well-being can look at those issues as well. So that's just one example. There are other studies that show as well, this is from the English longitudinal study of aging, which basically shows that people who are have a more positive outlook, more positive mental well-being, have better life expectancy than those who don't. So well-being has some profound impacts in terms of our health status and indeed in terms of our life expectancy. And these are just a couple of examples of a wide literature out there indicating there is actually a relationship now between well-being and actually protecting and promoting future health. Some of you in this room may be aware of the work of people like Corey Keyes in the States, and where he has shown longitudinally that better well-being at time A is associated with better mental health at time B. But today I want to argue is that it's really important, of course it's important to use accepted measures to evaluate the impacts of better well-being, but it's really about how we use these things that's very, very, very important. And I want to illustrate this by looking at some examples of how the evidence base has been used to influence policy actually and practice to some extent in the area of mental health. And that's I make no apologies for that simply because it's the area I know probably a little bit better than other areas. So I'm going to focus on some of the examples of mental health. And some of the things I'm going to talk about briefly are also published in a paper that one of my co-authors, Professor Christian Walbeck, is here as well in the room today, where we looked at some of the arguments for investing in prevention of mental illness. And it was looking beyond the conventional narrow approaches, thinking about things like green space, blue space, that kind of thing, better environments as a way of promoting mental health and well-being, and not just treatments and healthcare interventions. One of the examples that we've thought about in the past is actually about investing in interventions to improve the well-being of young people in schools. Now, I'm aware that you do in Finland. For those of you from Finland, you invest a lot in your curricula in schools in terms of mental health, resilience, and there's training for teachers as well. But nonetheless, this is an example from the UK of how investing in a program to actually promote teacher awareness of the importance of mental well-being, to identify challenges to mental well-being. This has now been evaluated in a cluster randomised control trial across 30 schools in England and Wales. And what we see from that, so the focus is on well-being, but we have a first published paper coming out, and there's a major published paper coming out soon on this. I say we, but the authors have. When they look at the outcomes, they're able to produce outcomes actually that are going to be useful to policymakers within the education sector as well as the health sector, because they can identify from this particular analysis that investing in mental health first aid actually has a benefit to teacher mental well-being in schools. It's partly because there's greater support for children who have mental health issues, which reduces stress in classrooms and makes it easier for teachers to manage classes and so forth. But it's also associated with better student well-being and better lower levels of psychological distress in students. In an English context, this is important because I think it's the same in Finland. Essentially, schools have to pay for a lot of these health promoting interventions. It's not necessarily from the Ministry of Health, it's from the schools. So if we can put forward arguments to schools that actually teacher well-being it improves through an intervention that's about well-being, it leads to reduced teacher absenteeism, reduced teacher turnover. That's something that schools find interesting. And also, if you can also demonstrate, which some studies are now starting to do, there's also a link between better well-being for pupils, students, and their exam performance, their exam results as well. That can also be an added incentive for schools to invest in well-being measures. And just to illustrate that point, we've been doing some work. Well, first of all, this is a slide from, again, I have to apologise for using British material, particularly in the current political climate, but a lot of the slides I am referring to UK evidence, and it you know, I think it's reasonable evidence, but it's British. But basically what we are saying here, or what was done, this was work done for the Department of Education, and this will come as no surprise to anyone in this room. If you actually get some qualifications, you're going to earn more money in your lifetime. Okay, so no shock, no horror about that. Get more qualifications, expected lifetime earnings increase. And what we've been doing, some work in England looking at investment and wellbeing interventions. So it's not just measuring wellbeing, it's looking at when it's delivered and how it's delivered and what impact it can have on young people's futures. And the reason we can say that is because we are thinking about wellbeing measures that may not last for a very long time, but if they're delivered at a time just before children are about to go through the phase of doing major exams, even short-term benefits of improved wellbeing can have long-term consequences. And with a very crude, but I think practical slide here, we can identify the costs of school-based programs compared in very crude terms to costs avoided as a result of better mental well-being at school, but also the long-term benefits of better life earnings as a result of doing better in exams. Of course, you can retake exams, but not everyone does that. But there are benefits, and there are lots of studies actually that show this in different contexts, but early years in investments, education, educational support interventions can pay off both for teacher well-being, parent well-being, student well-being, and they can have long-term consequences in terms of lifetime earnings, and also actually reduce risks of harmful habits such as smoking and drug consumption. So that's one example. So the idea here is not to simply to say investing in well-being in schools is the thing. The point is, if we can measure and know more about well-being for students in schools, what does this mean if we can improve it? What are the benefits of doing even more to improve it? Why is this such an important topic? It's important because we can demonstrate it has outcomes as well. Well-being is good in its own right, but it also leads to other outcomes that are positive and can be used as a justification for investment. Another quick example of this is bullying. In Finland, 90% of schools roughly pay themselves to deliver that, to provide something called Kiva. I'm probably pronouncing that wrong, but anyway, Kiva. It's a program dealing with both real-world bullying and cyberbullying in schools. There's good evidence, both from Finland and indeed from other places now, that it is effective and indeed it is highly cost-effective. And we've done some work in a UK context where we've looked at the long-term impacts of bullying interventions. So I'm assuming here, and again, this is about definitions of what well-being is, but not being bullied or not experiencing bullying or not being afraid to go to school, I think that's a positive aspect of well-being if you can avoid those things. So it's again something to try and capture and measure. But we've been able to look at evidence. Actually, there is evidence on what happens to children who have been bullied over a long time period, and the impact it has actually across the life course. And we have some data, it's old data, admittedly going back to the children born in the 1950s, but nonetheless, we're able to link that to show that if you actually invest in Kiva, and if the effects that we see in terms of the reduction in bullying do indeed correlate with the long-term impacts in terms of life chances, then there's a very positive long-term return of investment of more than 146 euros for every euro you spend to the age of 50. Of course, not everyone will believe those statistics, but nonetheless, I think they're quite valuable to show these numbers. We can demonstrate short-term costs in terms of reductions in absenteeism, reductions in health service use, but we can highlight benefits in terms of reductions in adult earnings lost, and reductions and improvements in wealth and reductions in health service use. So it's just another example. But again, the point here is not to talk about interventions for bullying. It's about thinking about well-being in a different way and thinking what we do with our measures of well-being. How do we use them? How do we operationalize them to actually invest in things that are going to make a difference and help us to achieve whatever we want to achieve? I won't worry about that slide. Just one other one to mention here on this, and just another example, simply because it's something we do a lot of in England at the moment. Helpfully, it doesn't actually say what I'm doing here, but this is about loneliness. Now, I don't know how many of the conventional well-being measures think about loneliness and isolation, but some of them certainly do. And certainly it's a topic that's getting more policy resonance these days because there's more evidence suggesting an association between loneliness and future poor physical and mental health, use of social care services, those kinds of things. We've again done some work drawing on evidence of what works to identify short and longer term impacts on well-being, on loneliness. And if you think of reduction in loneliness or loneliness-free years gained, if you can see it down there, is a benefit, a well-being benefit, we're also able to show a return on investment. And this is something that's actually been used by our National Public Health Agency, Public Health England, to help local decision makers think about whether or not to invest in well-being loneliness alleviation interventions as part of their health promotion strategies. Very quickly, because I don't have very much time. I think another issue in terms of measuring well-being and what we do with it is also about targeting. And I just want to give one quick example of this, which is around work. The European Agency for Health and Safety at Work, they've had some work done for them, an analysis of different European surveys. And the point I wanted to highlight here is that there are different types of enterprises where there's actually very little in the way of investment in psychosocial well-being. So maybe there are areas where we need to target investment as well, and thinking about targeting, so it's not just the measures, but how we actually apply those and how we use our resources as well. So investing perhaps in the challenging area of improving the psychosocial health and well-being of small businesses, small workplaces, not easy to do, rather than focusing on larger businesses where actually there's reasonable psychosocial procedures already in place according to that data. It may be about focusing on specific types of traditional industries as well as new industries, such as agriculture, forestry and fishing, where again, typically in the past, because these have been small-scale operations sometimes, independent traders or families, they have their psychosocial health has not been looked at so much, and yet we know in the case of farmers, you know, if it rains too much or if the price of milk goes up or goes down through EU quotas or whatever, it makes a big difference to their well-being. And I won't really say too much, well, I won't say anything about this slide, except to say the slides are available actually, but there are interventions that demonstrate there's a value in investing in well-being in workplaces. I want to end just by talking about one other thing to put onto the table, which is to deal with this issue about trying to put a value on things that are not easily valued in monetary terms. And a couple of things to mention. Some of you in this room are probably very familiar with this concept of social return on investment and social return on investment modelling in this case that I'm going to mention here now. Now, again, in a UK context, our Ministry of Finance produces guidelines on how to do this kind of analysis. They provide recommendations on how to quantify the benefits of some things that are not easily monetised. And it's a process that's been used more and more. I would urge exercise a little bit of caution, though, because the results of social return on investment are only as good as the information that's used to actually generate them. And you have to be very, very careful about the assumptions that are made. But nonetheless, I just want to show an example of thinking beyond conventional ways of measuring the economic value of things by looking at the social return on investment analysis done for sport as part of investment and wellbeing in England again. So in this stage, it's a very different way of thinking about things to conventional cost-benefit analysis. You identify all the potential stakeholders that could benefit from this or who might be responsible for funding this. So it's cross-sectoral and it's different kinds of actors, different participants. It's about trying to identify the level of resources required to deliver this, both monetary and volunteers and other things as well. It's about audits of activities, it's about measuring outputs, and then it's about valuing outcomes. And in this case, it's not just about health, it's about education, it's about reductions in crime, where they've been able to link evidence to these outcomes, and it's about subjective well-being and improved social capital, cohesiveness in society. And then you get some nice slides showing that the outcomes are more than the costs, okay, in this case, and various things you can see on the slide there, including the social well-being and the human capital there as well. So I've tried to go through things very quickly, and my point has not been to say that I'm trying to summarise all the evidence on what works, because there's a huge amount of evidence out there. But the point I'm trying to get across is that it's not just a question of how we measure well-being, it's how we then use the metrics that we have and how we can apply them across countries. So I think we do have evidence on many positive benefits of better well-being, certainly around health and education. But we also need to think, when we're thinking about measures for well-being, about the fact that these actions are delivered across many different sectors. And that means as well that we have to think strategically about what the outcomes and measures we use are, so that if we're thinking about investments in well-being that are focused on schools, we actually come up with some metrics that also demonstrate benefits of well-being from a school perspective as well as a health perspective, for instance. So I hope that's helpful. I know I've gone through some points very, very quickly, and I hope it's helpful then for Michele to go on to the next with his presentation. So, Gitos, thank you very much.
So while we are taking the next presentations from the computer, one question is now possible for someone. Very burning question, or of course you can save these for the discussions later today, but just now, yes, please.
Thank you. Thank you for very interesting and talk that was also very rich in a lot of information and a lot of facts. I have the question exactly on your title of this. So, if we think about metrics for well-being, and you said we have to come up, we have to formulate. So, who are we? And what I mean by this question is that is it possible to have metrics, the same metrics for many countries? That would be an advantage to then have cross-country comparison, or we have to really customize it for every country and for every context?
It's a very good question, and I'm going to give a diplomatic answer in the sense that I actually think we do need both. I think there's a strong advantage within the European Union and beyond to have some common metrics. So I think it's at the World Bank they have the Human Capital Development Index or something like that now. And there are other metrics like that. But, and I think there's a big but, that there still should be scope, in my view, for having very context-specific and country-specific measures where, and I think this is crucial, I think at the conference we talked about co-production or co-design. And so if we want a measure of well-being that really genuinely represents in different sectors perhaps the outcomes or the perception of well-being, then we have to involve a wide range of stakeholders in that. And there are mechanisms for doing that. that could be used. So it shouldn't just be about what professionals or experts think about well-being. There should be a process to try and develop this. But politically, it's also helpful to be able to compare countries and compare sectors as well. But there has to be room for adjustment. So I hope that sort of answers, even though I didn't give you the direct answer to the question you wanted.
Yeah, thank you so much. So we'll continue with the program now and come back to, possibly to come back to these issues later in the discussion. So next we have from OECD, Dr. Michele Cecchini. I hope I pronounced it correctly. Yeah, thank you. So, and his area of work in the OECD is a program of work on public health, which includes 3 main areas of work: preventing unhealthy lifestyles and major risk factors, tackling emerging communicable diseases with focus on antimicrobial resistance, and assessing and providing advice on reforms to improve public health systems. So very broad and very important area. So now we'll hear from perspective of OECD. Please, you have the floor.
Many thanks for the floor. Good afternoon, everybody. It's really my pleasure to be here this afternoon and to tell you, thanks, a little bit of how at the OECD, more in general, but with a particular focus on the group working on public health, we try to operationalize some of the work on the economic of well-being. So my first slide, perhaps it's also my answer to the question of that came from the floor on whether there is the need of different indexes or different types of measure, whether they should be specific for countries or should allow cross-country comparison. I'm very much in agreement with what David said. At OECD, of course, we are interested more in the cross-country comparison. And a few years back in time, we came out with the OECD Better Life Index. Here, the red arrow shows Finland, and you do pretty well. And the OECD essentially Better Life Index is our response to go beyond the cold numbers of GDP and economic statistics, but try to bring together all the things that matter to the well-being of population and try to synthesize. Of course, this is a very difficult exercise. There are a lot of limitations. We agree on this. But if we can, if we want to come up with a single number, that's our response. And now, to let you understand a little bit better what's behind the single number that rank Finland fairly well in the OECD, essentially the OECD Better Life Index measures the well-being of society across 11 topics. And you have the 11 topics on the left. You have topics, you have dimensions that reflect both material living conditions, income of a family, of a household, and the quality of life. Things like, for example, social connection, civic engagement, and so on. The other characteristic of the Better Life Index is that it doesn't just look at the today well-being, but we try also to capture whether the well-being that we can enjoy today is going to affect the well-being of the generations that will follow us. With things like, for example, human capital, natural capital, and economic capital, and so on. This was a big piece of work that tried to put in practice the recommendation of the Stiglitz-Sen-Fitoussi Commission, and we are now at the 3rd edition of the Better Life Index. If we look specifically more at the results for Finland, you have here on the right the results for Finland for all the different 11 dimensions. And Finland excels, is among really the top countries in OECD in terms of education, life satisfaction, and environment. There are some priorities for action, for example, in terms of income, civic engagement, and housing. Now, if we look at the health measures, including the public health index, overall Finland does fairly well. But if we wanted to be a little bit picky, a little bit precise, well, perceived health status, for example, is lower than in all the other countries part of the Nordic Council. So that's, in terms of health, perhaps an area in which Finland may want to pay more attention. So, starting from the Better Life Index, how we are trying, essentially as we speak, to translate this in policies for public health. As public health, we do a lot of work together with countries to help countries implement policies, best practices that support the lives of people living in OECD country. But how we define a policy that can help and can support this effort? We do this according to 6 different items. This policy should improve population health and their lives, their well-being. It should provide a good return of investment for countries. It should decrease health inequalities more in general, but clearly our focus is primarily on health inequalities. It should be a policy that is affordable to implement. It should be feasible, whether politically or practically feasible, and it should be scalable and transferable. There are some policies that work very well, but work on very specific settings. We want policies that, as much as possible, we can scale up at the country level, not just at very subnational specific level, and across OECD countries. To do this analysis, we use both a mix of quantitative and qualitative methods, but I think our really strong point, our bread and butter when it comes to this assessment is a microsimulation model in which we have been investing for more than a decade now. Essentially, the microsimulation model can replicate the dynamics of more than 50 countries, including all OECD countries, G20 countries, European countries more in general. We take data from a different number of sources, and we replicate what happens in the real world. We simulate, we make it a little bit simpler on certain aspects, but between now and 2050, we can see how the population of Finland, for example, will evolve in the future based on the behaviors that the population has right now, whether population does a sufficient level of physical activity, the type of diet that the people in Finland have, overweight, alcohol consumption, tobacco smoking, and so on. Because of these characteristics, plus demographics and so on, people may develop diseases, cardiovascular diseases, diabetes, mental health problem, dementia. We cover about 50 diseases. And because of these diseases and their health status, they may have a better or worse well-being. They may need healthcare expenditure. They may be more or less active when it comes to the labor market outcomes. And we are also trying to implement, we have already done some evaluation on school performance on school, which are essentially based on the same type of analysis that David presented in the previous presentation. Now, here are some very, well, the results are final, but it's a little bit a spotlight on the new publication we are going to deliver on the 10th, to release on the 10th of October on overweight and obesity. In Finland, we calculated that 9.4% of total healthcare budget is spent on treating overweight and related diseases. Here on the left axis, you have the figure in dollars, and on the right, but essentially 9.5% is among the highest if we take into account European 28 countries. Now, and this is because overweight, as I mentioned, increase the probability of developing key chronic diseases. But these persons, beyond being affected by the diseases and experiencing a lower quality of life, they are also more likely not to participate to the labor market. People that are overweight, in particular women, for example, more than men, are less likely to get a job, so they are more likely to be unemployed. In some cases, people have to retire earlier from the labor market because of the diseases. If they participate to the labor market, they may have sickness leaves or being less productive. And of course, this affects both the economy, but it affects also their income, which is another of the dimensions that we include in the Better Life Index. And as you see here, for example, in Finland, once we take all the effects of absenteeism, early retirement, employment rate, and presenteeism, about 40,000 people do not, it's like taking out from the labor market 40,000 people every year between now and 2050. Now, it's not just a matter of measuring this risk factor, but trying to find the solution or the policies the country can put in place to tackle these risk factors. And these are some results for packages of policies. We call them physical activity package, communication package, and mixed package. Essentially, they bring together different types of policies. Let's take, for example, the physical activity package. We are talking about policy on promoting physical activity in different domains, prescription of physical activity by primary care doctor, investing on public transportation, so to decrease the effect on the environment and at the same time promote active traveling in the population. Intervention in the workplace, standing desks, or places where people can bike, they can put their bike when they come to work, and so on. And similarly for the other packages. And as you can see, the impact in terms of diseases, but also health expenditure and available labor force is significant. This, of course, has an impact both on the economy of the countries and on the well-being of people. Now, if we take everything into account, all the different effects, we see that investing on this type of intervention is an excellent investment for OECD countries. Across the intervention, for every euro invested, countries can expect to get back in terms of increase of the GDP between essentially repaying for themselves and up to 6 euros for some of this intervention. And also all the packages perform very well and are very excellent investment. Now, what we are trying to do is to enrich the number of output we produce, also to include the effect on the Better Life Index. So, for example, this is the graph essentially that I showed you at the very beginning of my presentation, where Finland was ninth. We have evaluated, and please look at the statement here, partial analysis for illustrative purpose only. This is still very much work in progress. If Finland was extremely effective in implementing policies to tackle obesity, the Better Life Index of Finland would increase fairly significantly, and from the 9th position would achieve the 6th position in the Better Life Index. And this is our road ahead. These are on the left. You see the different dimension of the Better Life Index. And here is how we believe that we could further improve our analysis on the effectiveness of policies on the Better Life Index. I'm going to stop here just with a reminder that we are going to discuss about the work on public health on the 7th and 8th October in Paris. There is our annual meeting on the economics of public health, and there is also some work that we would like to discuss with countries on the economy of well-being and how OECD could do better in assessing public health policies when it comes to evaluating their in terms of well-being of the population. The 9th of October, there is the joint meeting with the WHO on obesity with national public health agencies involved in the STOP project. And then on the 10th of October in London, the launch event for the obesity publication. I stop here. I thank you very much for your attention.
Thank you. And once again, there's an opportunity to make some questions or comments while we'll change for the next presentation. So, yeah. So we have to, and please introduce yourself so we know who. Yeah, Seppo first.
Hello, I'm Seppo Koskinen from Finland, the Finnish Institute for Health and Welfare. My question concerns the index composed of 11 components, and I suppose they are averages or prevalences, not and at least some sort of resource aspects of well-being. There's a limit so that if you have very high income, it doesn't improve your well-being in from other points of view. Whereas if you're poor or if you're not poor, that has a great impact. So instead of average income, for example, or average education, indicators such as prevalence of poverty or prevalence of illiteracy or something like that. Have you considered this kind of distributional aspects?
Yes, that's a very good question, and it's my fault because I didn't say much at the beginning of this. But there are 11 dimensions, but for each dimension we have a number of different indicators that are taken in account. And as much as possible, there are also indicators on inequalities by gender, but by also different socioeconomic status that enters into the index. Then in the index that I've showed, we set the plain vanilla scenario, if you want, where all indicators are set with equal weight, but we have an instrument that allows people to say, for example, I care more about inequalities, so dimension that capture inequalities in the country should weight more than, let's say, civil participation or this type of things. Of course, I couldn't present a full range, but yes, inequalities, to the extent this is possible, are taken into account.
Then we have two more questions, very short, please.
Yeah, Martijntje Bakker from the Netherlands. Looking at your index, I was, of course, very interested, looking at the Netherlands as well, but we actually move down if we invest in overweight, if I look at your Better Life Index. So should I ask my government not to invest in overweight anymore? Should people become fatter, or are we not fat enough? Or how should I perceive the index?
No, the index, when I showed the effect on Finland.
Yeah. So Finland is moving up, but the Netherlands actually moving down.
No, I think the worst case, the Netherlands is staying the same level
No,
because
we're going one down.
One down because Finland overtook you, essentially.
We have more obese people than you have.
Okay.
Because of that, I suppose this is a very practical interpretation. So, yes.
Yeah, thank you. Just a question for clarification. You talked about that you assess the effectiveness of policies in the different dimensions of the index. Is it effectiveness only or cost effectiveness?
The index in itself looks at the cost effectiveness. Then this information is complemented with other types of analysis we do, including the cost effectiveness analysis. But in the index itself, it doesn't include anything on cost effectiveness of policies, only capture the well-being of the population, independently from the cost of achieving this well-being.
All right, thank you so much. So we'll continue for a further presentation of this session. And we have Leena Ilmola-Shepard, who has been working for a while as senior scientist in the International Institute for Applied Systems Analysis in the Advanced Systems Analysis program in Austria. And she is responsible for development of a qualitative systems methods and decision-maker connections. So please, you have the floor now.
Thank you. This was really a brilliant layout setting, because I will continue exactly from Mikael was finishing this presentation. So I'm proud to announce that now we have about world's premiere in presenting the new model that we are going to present now. My dear colleague and boss Elena Rovenskaya had a very brief presentation in the morning, and I will continue from that now here. So I'm not so much speaking about measures. I'm speaking merely about policy planning, because the model that we have built should address this type of questions that are typical in policy making. Like one of the decision makers asked me that, tell me when the Finnish economy will collapse, and how many immigrants we can afford, and when is the threshold that we will collapse. So the policymakers' questions are kind of holistic questions, and the challenge is, of course, that you have plenty of different kind of actions, and you should be able to compare that. What is the impact on either an economy? That is something that economists are able to assist with. But when we try to discuss these issues, how to compare these examples and think about what would be efficient and which type of really measures are improving well-being. Now the title of this short session was about alternative approaches. So I would like to present here really an alternative approach. That is, but anyway, it's based on solid basis of OECD better life indicators, well-being indicators, and so those are the indicators. They have been designed for comparison purposes, for kind of analytical purposes. Now, when we are looking at them from policy planning purposes, then we end up to this mess that somebody called this morning as a spaghetti bowl. And as you see, it is impossible to read, even for me, that I have been a part of the team that has designed it. So this is totally hopeless from a policy planning perspective. But still, what we have been able to capture, this is only a draft, but we have been able to capture the systemic nature of well-being. As we have heard during these 2 days, that everything is connected to everything. And this is really complicated policy or decision maker problem, wicked problem as we know. So while we are speaking about systems analysis now here, instead of defining a couple of set of indicators that would reflect the level of well-being in the country, what is the most exciting for me is that when we know, when we have been able to describe the system, we know quite a lot about behavior of the system. And when we know about behavior of the system, like national well-being system here, then we can say quite a lot about that, how the system will react when you try different kind of policy interventions. I'm a different kind of scientist, systems scientist in that respect, that I'm working with qualitative data, not quantitative data. And for qualitative analysis, it's enough to know the structure. We do not have to have exact data of exact every component and their links. So this is impossible from policy planning perspective. Especially, oh yes, there is another aspect that I have to tell you. Here you can see that this is crazy. We have combined economic system, natural system, human knowledge system, and social system into one system map. And that's why it looks so complicated. But these are all the fields that we have to cover if we want to understand the nature of well-being, as we have heard during these days. And now, going back to basics, because I'm going to show you one example how you can use this spaghetti bowl for policy planning. So these are the principles. This is a very brief example. We know that girls' education is decreasing population growth, and lower population growth will provide women with more earning opportunities or free time for getting their own money, and that will have an impact also for educational attainment. This is the study made by Wolfgang Lutz, one of our colleagues from JASA. So all of these are related to each other, and from the literature we know that earning opportunities for women, when they are increasing, they put their children, and especially girls, to school more frequently. And when girls are going to school, then the population is growth is decreasing. So the red arrow here means that it's inverse impact on population growth. And when population is growth is ceasing down, then women have an opportunity for earning some more money. From primary school, we know that if in any calculation we have 2 minuses, so that means plus. So this is a reinforcing loop. So whatever you do in means of different kind of policies, it will kick off a very favorable, virtuous cycle that will continue forever until you do not have enough people in the country. Perhaps we ought to make it a little bit more difficult for women to go to university. We will have more children here in Western world. But that has some other implications as well. I found this kind of, this is from OECD as well, this kind of picture about well-being, and now I heard that David already mentioned about mental illnesses, and you have studied that. So this was not necessary, but this was the first time during this conference that somebody was really speaking about these issues. So that's why I chose mental illnesses as an example, as a dimension of well-being. And now I will show you how we can use this spaghetti bowl, for instance, for looking at the aspects that, according to David, have great impact on mental or prevention of mental illnesses. And that requires including or to look the need to look at the human social capital system. Our partners in this work have been Prime Minister's Office of Finland and Prime Minister's Office of Israel. And now when we, when we wanted to base all of our analysis on OECD indicators, so somebody in Israel said that let's forget this social capital issue. It's too complicated. You know, we cannot measure it properly. Very, very intelligent economist was the person that was speaking. But here, when we are speaking about qualitative analysis, we are able to also include human capital system. This is one of the, I think, about 6,000 feedback loops of the spaghetti bowl. So only one example. And this is something that we have to study further. It is prominent in that respect that it covers both economy, education, and social system. In this example, we do not have natural system included. Elena had an example of that this morning if you had an opportunity to participate to the session. Okay, these components are dependent on each other according to our system map. So, but that does not help. But when we break this feedback loop into parts, we can see that it consists of loop A, loop B, C, and D. And now from policy perspective, if our proxy for better life is in this case lifetime expectancy, so now we want to create a policy, efficient policy that would improve lifetime expectancy. So how to do it? Of course, to increase average household income would be really powerful. But as we know, it is really problematic, especially for a small open national economy like Finland or Israel. So you cannot manipulate it. You cannot afford to manipulate because it depends on the global markets quite a lot. So this is not perhaps the most efficient one, especially with a certain, according to some basic assumptions, this is a balancing loop. So whatsoever you invest in household income or employment rate, this loop seems to kind of little by little, round after round, will balance your investment and diminish its impact. So what we can do here is that we can look at couple of issues. Loop A C is a positive reinforcing loop. That means that if you're able to increase any of these components with the policy actions, you will kick off a virtuous process that will improve perception of meaningfulness of life. That is a proxy for happiness, according to literature, and that has a positive impact on lifetime expectancy. So, you try to identify for policy planning purposes that type of feedbacks that lead to the desirable dynamics and behavior of the system. If you are able to find components that are members of many positive feedback loops, reinforcing loops, then of course that is the most efficient. That you should have your policy focus on that issue, because it's serving plenty of different purposes. Okay, this was only a very small example of our system. And we have developed a way how to simulate this type of qualitative systems. I don't go into any details here. And this national well-being system is not ready for this type of simulation because some of the essential information is missing. But this is our objective, that with the different policy alternatives, you can check that what are the potential positive and negative impacts of that specific policy. So now this is my value proposition and my request, please join us, join to this pioneer work we have done with Finland and Israel. And because in order to develop this generic model, we have exactly same problems as you have. Everything is, the part of the model is very contingent. What is true in one country is not true in another country. So what we want to do is that we have to first validate this theory-based model, because you can find justification for almost anything in theory, and to gain some insight to use some insight of experts that really know well this area, and validate the model. And then we are kicking off a development project that, in the best of the places, would lead to a way to plan more efficient policies. Thank you.
Thank you so much. Really interesting. Now you all got the invitation to join this work, so you can be in contact with Lena if there's something interesting. So one question before we go to the panel discussion. Not just now, so we'll continue with our program. Thank you. Thank you so much, Lena. Yeah. So panelists, please, you could come here, and I'll turn to our moderator. So next session will be moderated by Noora Heinonen from Ministry of Finance. Please, Noora.
Thank you so much. I'm the layperson here, so please excuse me for asking all the dummy questions. Good afternoon, everybody. My name is Noora Heinonen. It's a pleasure to be here, and thank you for the invitation. We have a very professional panelists here. Let me start by introducing all three of them, and I'll use only the first names because some of the names were a bit tricky for me. So firstly, Miss Martti. Please say your name yourself. It's easier that way.
My name is Martijntje Bakker and I'm from the Netherlands.
Okay, and I call her Martti because that's the name I call my mom also, so it's a bit more easy for me. Martti is the co-director of John MV, yes, and she is responsible for the international collaboration and strategy development. In the past, she has worked at universities, local government and national funding organizations. And now she is affiliated to the joint programming initiative called A Healthy Diet for a Healthy Life in the Netherlands. Good. Then the second panelist on the right-hand side is Mr. Juha Honkatukia, who works currently at Finland's Finland's National Institute for Health and Welfare, and has previously worked in the Technical Research Center of Finland and VATT Institute for Economic Research. And his main duties consist of the delivery of economic impact assessments regarding Finland's social and healthcare reform. And he develops also a macro simulation model concerning the reform. Hopefully it went correctly. Good. And last but not least is Mr. Robert Arnkiel, who has worked for 30 years and has experience in research and evaluation, particularly concerning public employment services and labor markets. And he has worked as a career counselor and researcher and is now an independent expert in his own company. So please welcome, and it was lovely to have you here. Hope we have a lively discussion. In Swedish, you say "Nu kör vi igång." It means something like "let's start." And the first question, I go directly to the questions, which we hopefully have also sent you in advance. During the conference, we have now discussed on the economy of well-being. That is the theme of the Finnish presidency, as we all know. And the first question would be, what is your view? Where are we now? Especially when we think this theme from methodological viewpoint. Please.
Well, does it work? Yeah, it was. I'm not a methodological expert as such, but if I look from the perspective of the JPI Healthy Diet for a Healthy Life, which is a collaboration between countries who try to actually connect the field of food and food production to health, this economy of well-being makes a lot of sense to us as well, because that's what we're working on. So what we actually try to do is to see how we can make sure that whatever we develop in food production, for instance, affects people's lives and affects people's lives in a better way. Like, for instance, the overweight paragraph we just saw. It's very important to invest in that, because that actually makes sure that the economy of your country improves as well. So investing in agriculture and good food production, but taking into account health aspects, is very necessary to do. So I think we are moving in the right direction. It's just not always very good supported by evidence in a way. So like, for instance, the presentations we heard before make clear that if it would be helpful to help policymakers in advance to make the right choices, it makes our lives easier to make build our case to where they should put their taxpayer dollars in euros. Yeah.
Well, thank you. My point of view to the theme or the concept of the day is promoting employment and employability, and I think this, well, for Finland this is a vital issue. It's of course an issue for any country. It's a question, if we look at the strategic challenge that we have, it's how to mobilize a diminishing workforce more efficiently. And we know, of course, that gainful employment is a key factor in well-being of people, not the only one, of course. And I think that where we are concerning promoting employment and employability from a well-being perspective is that the knowledge about the factors influencing well-being, the data and the actors are quite dispersed. It's a very complex field, and on top of that, looking at the end result, which would be gainful employment, we are not able to measure the steps towards open market employment clearly enough. I will elaborate on this point further in the panel, but the fact that I want to emphasize is that we are able to measure if someone is employed, or we are able to measure or illustrate that someone has gone into education or gone further in education, and we have rather good databases about is someone employed or is someone in education. But also referring to what David was saying in the beginning, we are not so good in measuring social capital, social cohesiveness, innovation, creativity, subjective well-being. These are steps towards a goal, and we are not very good at measuring these and putting them on the table, and that is why they are left as a second order emphasis.
Many of the issues that I've thought about have been already touched by the speakers before. So maybe I'll start with pointing to one deficiency that I can see. I've done a lot of work with climate policies, climate change over the past, actually almost a quarter of a century. And one of the issues that keeps on recurring is approximately the following. If you want to do something cost efficiently for the climate, then you need to start taxing pollution, but then you'll be gaining revenue, and you can use that revenue to alleviate some other problem in the economy, and maybe, God knows, you might have a double dividend of sorts. And in that context, it's very clear that we know where the pollution comes, and we know something about the labor markets. We know what to do with the extra revenue we're getting from the environmental taxes to alleviate the problems of tax wedges and stuff like that, causing inefficiencies in the labor market. And this leads to the following sort of consideration. If you try to apply something like that to the health and social care systems, one of the things that keep on popping because we sort of feel and anticipate the financial pressure of an aging population is that maybe we should do something about the financing of the care provision. Maybe people should be contributing more by themselves, or is it the case that we want to sort of make it more private or something like that? And oftentimes it's also a question of saving money. So what happens if you save public expenditure on healthcare according to national accounts? Then you are actually cutting down on public final spending. And that has no bearing whatsoever on consumers' welfare according to national accounts. It's just another aspect of final spending. So a lot of the work that we are doing at the Institute actually tries to get past this, so that we are allocating the public expenditure on health and social care to the households in different regions of the country, or people in different income brackets and so forth. And then this is very basic economics, but then you can start taking into account the effect of what happens with the care provision that is in countries like Finland, and I suppose also in the UK to an extent, or to a great extent, practically a gift from the government, if you will. Sure, it's bought by the tax-paying public, but for the person who's receiving this care, it's almost free. And if you do something with that gift, then you are actually not only affecting what happens to the health, but you are also affecting everything else that this individual is going to be doing. And this is an aspect that even in the static analysis we are already sort of having trouble to overcome with. So before we go into the dynamics and the dynamic effects, which I think many people have already sort of brushed on, I think there's even a static allocation problem that isn't properly dealt with. That has to do with a lot of the examples, for example, that you had. So we have this sort of splintered, if you will, data on specific effects, and I agree with you that David, that's something that we need, but we also need to take care of the bigger picture, because that's affecting the budgetary process.
Good, thank you. This is meant to be an interactive session also, so it's a free floor for any remarks at this point or later on. And though David said in his speech that it's something like on these lines, that it is not about how we measure well-being, but how we use the information, something like that. Hopefully I got it correctly. I still want to pursue the discussion on metrics and measurement. No questions at this point, so we'll take it a bit later. But I'll squeeze some questions out of you.
Yes, we really hope that please come to discuss with the panel and challenge them also.
Yeah, we don't have to agree on everything here. Hopefully not. Yeah. Well, anyhow, you touched upon already the questions on metrics, but I still want to pursue or hear some more elaboration from you on the benefits of those tools that are used at the moment, and especially on the weaknesses and what should be done to improve the situation.
Well, I think there are a lot of things available, like, for instance, health impact assessment, which actually looks, if you want to, implement some policy guideline, what will be the effects on health and also on well-being. But I think what is lacking is the willingness of countries to compare their policy measurements. So so it's usually difficult to finance that kind of research. And what we are currently funding by the JPI, Healthy Diet for a Healthy Life, is something called PEN. It's the Policy Evaluation Network, where actually countries are putting their numbers on the table on different policies related to nutrition and health, because that's what we are about, and to see what the actual effect is on health of people, on populations. So things like that, I think, is very important to compare policy measurements. I think that's also something the last speaker wanted to pursue, to change, look at what's going on and what is the actual effect on people's lives, because I think that will actually help governments making the best decisions.
Well, I would like to elaborate a bit more on the main point I'm trying to make, which is that towards the end of gainful employment, which has a lot of implications to the well-being of people, we are poor in measuring the steps towards gainful employment. I would like to use the concept of Günther Schmid. He used it where he said we should have the eye on the transitions, the lifelong transitions, because they are critical in people's lives. What he means is that we have transitions within education, we have transition from education to employment, we have transitions from not being employed back to employment, from sickness back to employment, from family life back to employment, even from pensions back to employment. These different transitions are critical, but we are rather poor in providing data on to what extent these transitions are actually gainful. We only get the sort of end results, but we don't see enough the steps towards that. So my point would be that we have a lot of data, but we should clearly improve in having a clearer picture of the transitions in people's lives. This is compounded by the fact that we don't have enough long-term follow-up of what happens in people's lives. Let's say like chronic unemployment. We have facts about the sort of shorter term, year or 2 or 3 years of employment, but in fact what has the most effect on people's lives is a chronic poor working career that can span over a decade or even 2 decades. And it is a proven fact in some very good studies that this has a lot of effect on the people's well-being, their status in its social status, etc. So the fact is that we have very poor possibilities within short time in different projects to actually capture this longer term transitions and the intermediate steps.
Yeah, it's easy to agree with you on that aspect, but there's also at the Institute of Health and Welfare here in Helsinki, we have access to tremendous registered data. So at the given moment, we pretty much know what's going on with the population at that time. So you can get these, like Lena was talking about, these profiles, risk profiles, or transition probabilities for a healthy state to a not so healthy state, and so forth. And then you get you can basically start modeling the transition and then making predictions about the health outcomes. And actually, there are some useful examples where Finnish data has been used in such a way. I've got a couple of dear colleagues at the Centre of Policy Studies in Melbourne, Australia, and they have been using Finnish impact data on type 2 diabetes prevention, where we know pretty well. They tell me it's the easiest of all these big killers or big diseases to handle, but you can sort of gauge the idea of what the prevention is doing to the transitory probability of actually getting sick one day. And then from that you can sort of figure out what that means in terms of avoided cost of care, and what it means in terms of not lost days at the job, and that turns into something which is very important, which has, I think, to do with Robert's idea of doing something or measuring something in terms of labor supply. So if people are healthy, then that means that the labor supply is going to be that much the better, and then that's good for the GDP and so forth. So you can pretty much go through all of this, given that you have the data. So maybe it's not that we don't know what to do. It's just that the data is fragmented in many cases. We are very lucky in Finland in that at the moment the institute is actually our colleagues are working towards a system that's been used as a basis for basically supporting the healthcare system regionally, and they're using data on basically the whole population when they do that. So that picture at any given time is very complete in Finland. But it's true that the issues like what happens to people's health status, or the population's average health status as time goes along and we get wealthier and we get healthier, it's something that you need to sort of sort out too.
Thank you. Now this would be a good chance for the first question. Let's take here, and there. Please.
It's a question stroke comment in a sense. How much time and effort should we spend on trying to ensure that we embed well-being and other metrics in existing and ongoing and perhaps new longitudinal cohort studies at national level and at broader level as well, for that matter? Because I agree entirely with the point made about using data from the past, but also circumstances change, and maybe we can't always rely on that data from the past. So as part of the whole debate about metrics, maybe there's all the issue about embedding appropriate metrics into existing surveys so that we do have that ammunition in future to answer some of these longer term questions.
Let's take this second question in a row, and then.
Well, mine, Michele Cecchini, OECD, just for the records. Mine builds really on I think, David's question, because my question for you was that to what extent what we measure today is useful to inform our policy making for tomorrow? If we look at some of the dimensions that we've been discussing, employment, for example, or even education, colleagues in the employment division a few months ago released a publication on how the employment market will be changed in 10 to 15 years from now. And I'm not sure that some of the metrics we use today may be applicable also in this time frame. Very similarly for education. I know that Finland is probably a country, if there is one country to look at in terms of education, Finland is certainly a very good candidate. But do the skills and the things that and what we capture today when it comes to education really reflect what we'll need tomorrow for policy making? And similar to other dimensions, these two are particularly, I think, critical, particularly if we look at the future, but more broadly also others.
Let's take Joseph.
Actually, I changed my question. I'm going to challenge my friends and colleagues here. Michelle, how much is it data for, do we need, is it not only data for the future policymakers, but data for the current policymakers? And David, I'll develop that further. And David, do we really need indicators of well-being? So let me take you further here. How much the issue is the data? If I'm a policymaker, I have to be careful. As the director of the observatory, I may end up undermining my own job and my chair, who's around here, cutting, she's not here, that's great, I can say that. May end up cutting my budget. But how much is data and how much is framing that data for policymaking? Look at this conference, which has been fascinating. How many ways we approached well-being, in how many measures, in how many ways. Actually, a while ago, I was doing an exercise, just in health. And if we put together the economics of interventions in diabetes, cardiovascular, diet, smoking, and so on, we end up saving 500% of GDP, which is impossible, kind of. So that's one element about how we use the data. But secondly, the second thing is the way we frame it sometimes, it got to a point that the policymakers no longer understand what we're talking about. So I love data, I love indicators, but that energy, and I love OECD, Michelle, you know that, and we've done a great job together on the economics of prevention, the three of us, by the way, the observatory, David leading that, and so on and so forth, with, so there's a lot of record on doing data. But how much is the effort on doing new indicators? Am I happy, I'm not happy? My balanced life and so on, and work is good or not. We can discuss the rest of our lives, have salaries, bread and butter of our children. But listen, financial protection. If I have access to the health system, I'm going to be fairly happy. If my education allows me to be incorporated in the labor force, it's bound to be okay. And so on and so on. Data that we have, that we know, that we understand. Shouldn't we make the effort of framing these indicators in a way that saying the economic of these indicators and framing in a way they can use it in policy making rather than continue developing new indicators? I mean, I'm devil's advocate. This I do for a living. I mean, be careful here, and my chair is back. So, but what we do as well, because my chair is pushing us very much, is a lot, as you know, because we both were on the road together, is the knowledge brokering element. Is how you frame this data in the policy decision-making process.
Good. Now there are many interventions. Let's give our panelists now a quick chat and then we'll continue the discussion. Thank you. Very excellent discussions. And I love that you are not unanimous in this field. So please.
This one is on. Yeah, so I took the liberty of going first this time because I think I kind of agree with what you just said about these new measures. There was some talk about these different, well, actually Lena was talking about these different dimensions of problems. We also have started a project that has to do with diets, food production, diets. I think the idea in that project, I only have a very, very small part of in the project, is to see how that would work in the context of preventing climate change. So you become a vegetarian or something, and that's good for the climate, yes. But you have all these layers that are being combined in that project. So if you want that to happen, then you must use presumably some kind of economic measures or measures that have an economic dimension or interpretation. So as an economist, I think, okay, well, we have to tax this and that, or maybe we put a subsidy here and there. And the point is that you can figure out the welfare cost in economic terms of doing that policies, and I think that's important. Years ago, maybe 20 years ago, there was a lot of debate of how wrong GDP was as a measure when you should also be accounting for what's happening with the climate and environment. Well, that's kind of right, but it doesn't mean that we should throw all these economic statistics away. We should amend them with the environmental element and the food and the health element, and that's what we are doing in this project. We also, I probably think we are going to be able to link the production and consumption of things and food and what have you, and services to LCA, so life cycle assessment, life cycle what are they called? Data on the long-term impacts on the environment of the material use of things. And I think it's not going to be the case that we pick one of those. I think what we need to do is that we have to sort of introduce some sort of multi-criteria optimization if we really want to sort of learn about that. I expect that the measures, when we get to that stage, will not produce the same good outcome with all the at all the levels, and that's the fascination with it. But I'm really optimistic that it can be done, and it's to me it's a more workable approach than throwing what we have away and then starting anew.
What came to my mind listening to some of the comments was the question of time, the time perspective that we have on these issues. Like again, going back to the very beginning where David said we should look at this more as an investment than a cost. Okay, let's put ourselves in the shoes of a politician. In order to appreciate that we, by investing into this, we are able to avoid costs in the future. Now, how convincing is that to a politician who is faced with the immediate costs of doing something right now? I bumped into this in local government, regional government, national government. It's a question of perhaps being able to translate our knowledge in a way that is better understood in the long perspective, and that's a huge challenge, of course. I think this appears in the same question of time, if you like, appears also in a field which I know much better than this very complicated well-being in the long perspective. It's evaluation of interventions. Let's say we want to improve employment, which I know better. The question again is about the time perspective that you have on evaluating this intervention. Usually the evaluation of the intervention starts too late. It's sort of missed the boat. It has missed the boat of controlled experiments because it's already contaminated the situation because it has already started. It's very difficult then to control the experiment, and the results are expected too soon. There's a lot of political pressure to demonstrate that this intervention has had an effect, where in fact in a year or 2 or 3 you can't really expect any meaningful impact on the kind of questions we're talking about, the investment likely in education, health, some of these. So it is very much in my mind a question of time and how time is appreciated in the political debate.
Can't avoid saying that sounds like very much like government's work and government's efforts, like 4 years here in Finland. That's the longest and the shortest time of all. Merti.
Yep.
For me, it also has something to do with the willingness to accept from the different policy levels that everything which happens is related to each other. And that a lot of, I think, the data are available, but in separate silos, and difficult to access for other policy areas. So, for instance, in another initiative I'm involved in, we talk a lot about the demographic change and the aging population. But if you want to work on healthy aging, it has to do with housing, it has to do with education, it has to do with social welfare, it has to do with health, it has to do with, well, at least policy areas in the Netherlands for 6 different ministries, who all have their different data sources where they rely their policies on. So at that time when we were working on it, we just developed a kind of a very, in a way, easy website just to kind of make available to researchers where all these different data sources could be accessed, and what the quality of the data was and how they could use them to do more different kinds of analyses. So it has to do with how can we make sure that whatever is available already can actually be accessed and combined, but also the willingness of policymakers to look at different areas besides the one they're particularly responsible for.
Thank you. Would you want to have a short reaction to Jose's comments?
Yeah, well, I'll combine it with a response to that the comments there on time. And I'm sure Michele will support me in this. One of the, well, I think he will. I think he will. One of the ways to get around the time issue. Well, if I said to you, global warming's an issue and we're worried about it, most people in this room hopefully will think that that's a reasonably fair statement to say. But it's based on modelling into the future, using data from the past to try and think and predict how things are going to change. And we can do exactly the same thing at maybe a slightly less sophisticated level for thinking about predictions in terms of policy interventions around well-being and health. And Michele and the OECD do plenty of this in the health sphere, projecting things in terms of the future, 50-year models, I think you have some, or long-term models. The point is, though, the key issue, though, is to what extent is that information from the past that we use to build the models going to be useful for the models of the future? We have to think quite carefully about that. And that's why I think, if we think we do need to adjust those models, that there is a place potentially for well-being. And dare I say in this room, sometimes people think well-being is just a catch-all term that can be used to really justify lots of things that should be important to policymakers. But the intrinsic nature of well-being itself as being something that can lead to other positive developments. The only way, well, one way in which we might be able to say more about that is if we actually start measuring, however you do it, what well-being as a concept in its own right, to see actually is investment in well-being over time going to lead to reductions in obesity. I mean, those kinds of things. So I think we can get around the time dimension. It's not perfect, far from it, but there's a history of doing that. And that may get around a little bit the political issue as well, because there are some areas of public health or children. Children is an issue which, for instance, it's less political in the sense that you can usually develop a reasonable degree of political consensus across political lines that investing in things for children is a good thing to do. But the point is it has to be backed up, in my view, or it can be backed up by these models or looking at Nordic data from the past and saying, look, this is what we can achieve if we have these better outcomes. So it's not dismissing these issues because they're really, really important, but trying to say how can we get what can we be like climate scientists or weather model people and have some belief that to what extent can we trust in models to get around the time issue?
Can we all be climate scientists? That was tempting. Now we continue. Eva, then Vertti, then Leena. Please.
Thank you. I'm Eva Olli. I'm currently working at the Cancer Society, but I used to work on the conceptualizing of health in all policies, which is a rather similar concept in a way. First, just wanted to highlight some of take-home messages that I thought that these excellent presentations gave me, and especially from David. I think it's like everybody knows that money talks, but well-being doesn't really talk in that way. And in his presentation, where he was showing, which I think is extremely important, that we have to think from the point of view of those people that we are talking to. Like, you know, what their own budget and what are they measured against. Like the school is not measured against well-being or health, they are measured against achievements. And if you can, like what the other two speakers were talking about, the developing the measurements together, I think that's extremely important, so that you have those kind of measurements that talk to the people that you want to have an influence on. And in that sense, I think that the Finnish earlier structures that we had, the Intersectoral Public Health Committee and the process of meeting with all the sectors once a year, 2 days, and discuss on, you know, common things, what common things that construct well-being. They're extremely important, so that you can build up that kind of understanding, because we still have the sectoral budgets. We are a very sectoral society, so if you want to do anything intersectoral, you have to build it up in a way that it talks to the budgets of each of the sector, and it talks to the targets that those sectors have. And then just 2 comments still, or questions maybe. One of them David already a little bit took, because I've been wondering why constructors and most of other sectors have it easy to talk about long-term investments, but we don't. Why is it so easy to tell about the benefits of building the bridge? You know, and the benefits come in 30 years' time. But when you talk about human life, it's like you have to have a yearly budget. And another aspect that I'd like you to kind of think about and maybe comment is that why is it that health is something that you measure against which is more cost-effective to prevent or to cure? But when we talk about art, for instance, is anyone asking you that is it cheaper to conserve that piece of art, or is it cheaper to glue it together? And somehow, why do we not have a value-based, and why don't we value human well-being and health in a way we value art, for instance?
Tempting question, and to be chairing here or moderating the discussion from the Ministry of Finance, so it's very delicate. I don't say anything, but now back row, Vertti, then Leena.
Yeah, Vertti Kiukas from SOSTA Finland. I'm going to speak thinking about Ministry of Finance, but because I'm a bit opposing Robert Angel's thoughts, because I don't think that the big problem are the politicians. I think we have seen, for example, this week, several Finnish ministers have said that they believe in these investment ideas. And if you look at the government program, we have the same thoughts there. But I think the big problem here is that the Ministry of Finance and its civil service, because if we look at the, for example, this government is trying to create 60,000 new jobs in Finland, but the Ministry of Finance can calculate only that if you cut down social benefits or lower taxes, they have some kind of effect on employment. But if you try to say that if we rehabilitate people better, if we do a better alcohol policy, or like we had very interesting data about overweight, these kinds of which we social and health politicians think that they are investments in better future, the Ministry of Finance will not calculate to them any kind of effect on, for example, employment rate. This was clearly seen, for example, in the government negotiations we had last spring. I think this is a bit changed now what comes to climate, because, for example, we banned burning coal in a 10 years time, which is, of course, in a short term economically stupid, but in a long term a very rational investment. And I think that the that we should look more what have the scientists on climate done. I think that was a good thought.
And we'll go swiftly to Lea.
Somebody said earlier, was it David or someone, about the future and modeling about the future. Now this is exactly one of the aspects that we have to take into consideration really seriously. It is right, models are based on past data and current mental models. That is exactly what we are doing. And but we know already that the future is really unpredictable. We tried to model immigration or asylum seeker crisis in middle of the crisis. And that was a typical example, and it will be a typical example where all of our models proved to be more or less wrong because we haven't met that kind of situation earlier. The next issue is that will change not only public sector funding, but also everything else, and our behavior is digitalization. So, but if we are really skillful, and this is a challenge for us modelers, if we are skillful, we are able to create models that allow policy planners and decision makers to kind of simulate different kind of also extreme scenarios. So that will provide some kind of cognitive framework to meet those surprises that we are going to see in the future for sure. And especially in the field of health. So, as we know, if anything can happen. So I think we have to have, but this is a technical issue. It's not, it's our responsibility to create those models, so that politicians and decision makers can test them.
Thank you. Very good interventions. Please, reactions from the panelists.
Well, I've modeled climate change decades ahead. Currently, I'm in charge of modeling healthcare expenditures decades ahead, and I think I did one on an extreme thing called the pandemic epidemic. We were basing that on data on the Spanish flu. So I think in the process of simulating that, we killed off something like 1.2% of the labor force. So, yeah, so I entirely agree that this is hopefully a useful way to go. And the only point I want to sort of add has to do with this, whether we are serving politicians aspect. In a methodology that many of you are aware of, which is called the sustainability methodology that the European Union is using for sort of measuring the fiscal sustainability of basically providing age-dependent care. There's an explicit allowance for some sort of sensitivity analysis that sort of toys with the idea that the health of future generation is going to be better than ours is. So people will be living longer, and then you can sort of figure out in a very, very, very concise and very simple framework what that will do to your potential GDP growth and the fiscal status of the country and so forth. And even though it's simple, I think it's a useful example of the sort of thing, an exercise that we can do. And the point is not to get the right point estimate. The point is to allow for that sensitivity analysis and increase the understanding of the decision makers of how these things are related to each other.
Well, I want to make it clear that I didn't want to put the blame on the politicians here. There, of course, can be blame for many things. Really the main point here was about time, and it concerns any actor looking at the time perspectives of the different possibilities of affecting well-being or employment. So I think it's a criticism to anybody who is involved with these. It's a challenge for each and every one of us. There's one thing, as time is a limited resource. There's one point which I would like to mention, which hasn't been really mentioned, and it is: are we able to listen and to measure how people themselves actually perceive their well-being, their subjective well-being? It's at the end of the day, it is a subjective matter. You can be rather ill and you still feel quite happy with your life. And here I would call for better methods to actually measure. It is, of course, a challenging topic, but I know of many developments here in Finland and abroad where even let's say this economy of well-being, which wants to capture matters like health, social involvement, the personal economy of the families, etc., etc. Now, in customer service, we should be able to actually measure how people themselves see their life situation against these different dimensions. It's of course done, but it's all dispersed in the different databases and within the actors, and most of this information actually remains at the desk of the front office where they talk to the people. So I would be calling for also methods on this micro level where we would combine this information on the micro level to databases on the meso and macro levels.
Well, maybe just something to add, whether we have the right measurements to measure well-being. I would like to mention the work which is done on the dimensions of positive health. We started developing that frame a couple of years ago, and it kind of as an alternative of the old definition of health from WHO, which was the absence of disease. Whereas we know that even though people might be chronically ill and suffer a lot, might feel very healthy anyways. So this new dimension of, or this new definition of positive health is about the ability to adapt and self-manage, and it takes into account 6 different dimensions. And it's actually worth, if you don't know this development, worth looking into, because it actually is in development with the right measurements to see whether we can come up with something else besides the absence of disease. Yeah.
Thank you. Now it's been very tempting to continue the discussion on multi-annual framework or European semester or decision-making powers or national policy framing, but we'll end here. Thank you, very good panelists. Thank you, lovely audience, and we'll continue. Thank you.
And while we have been sitting for such a long time, and sitting for a long time is not healthy, so please stand up for a while, don't go out, so because I'm afraid we are going to lose you. So just a little exercise on your place, and we'll change for the next panel. And we'll also change the moderator. So the next panel will be moderated by Ulla Rosenström, who's from Prime Minister's office. And you'll introduce the panel. So please, the panel members, please could you come here to the tables in front of the room, so and the others still can stretch legs a little, and while we are
Okay, so maybe we should get started. So we're now starting with the second panel, where we will, I think, continue in a way what we just already started, but then focus even more now finally on the use of well-being information. On the information that we have, then on the tools a bit, and then we also need to look a little bit more into the future of the next steps. And I'm very pleased to be moderating this because, like I said, I'm Ulla Rosenström from the Prime Minister's office, and I'm very interested in this information, and especially now that, as was just said, our new government program puts well-being in the center. Well-being is actually the goal for the economic policy of this government, and they've also stated in their government program that they intend to use not only economic indicators, but ecological and social well-being indicators as part of the economic policy. So this, what I've been hearing in these 2 days has been very exciting, and this more detailed or more concrete discussion that we're having here is actually very useful and interesting. But let me start by introducing the panelists. So we have Caroline Costangs, who is the director of EuroHealthNet. It's a European partnership for improving health, equity, and well-being, and it's based in Brussels. Better here. But I also like to mention that previously she has worked at the Netherlands Olympic Committee and Sports Confederation on physical activity, for young people from disadvantaged backgrounds, and at the Health Institute of the Liverpool John Moores University on urban health policy and intersectional collaboration. So that was quite an interesting background, and I'm very professional here. And then we have Josep Figueras from the European Observatory on Health Systems and Policies. You're the director over there. But in addition to this, you have also in addition to WHO, you have also served in major multilateral organizations such as the European Commission and the World Bank. And it's also mentioned here that you have served as a policy advisor in more than 40 countries within Europe and beyond. So, yes, that's very impressive. Actually, I have very long, impressive CVs here, but I'm just giving the flavor of the different jobs you've held. And then we also have Philippe Roux, the head of unit of DG Health and Consumers of the European Commission. But you've started your career at the French social sector and then worked with the DG Employment and Social Affairs. And from there, you worked also at the European Monitoring Center for Drugs and Drug Addiction, and then moved on to different positions at the DG Health and Consumers. Before I start asking you questions, I think I would like to start by hearing your first thoughts or your feeling of what is it with you and the economy of well-being? What makes you tick in that? What do you think that you were the ones that needed to, whose voice we wanted to hear in terms of the use? So please, we start with Caroline.
All right, thanks a lot for that question also. I love the concept of the economy of well-being. And actually what we would like to see is an increased investment in health and well-being. And first and foremost, that requires policy prioritization at the highest level of government for adequate budgets for universal and quality services. And I think that's really important, and the whole narrative around the economy of well-being helps that, I think, and we need to push this forward, and it is super timely now with the changes in the EU institutions. So that's very good. But we also know that budgets are limited, and we know that there has been huge underspending in social infrastructure in the past 10 years since the austerity crisis, since 2008. There has been underinvestment in social services, in housing services, in education, in health services. And at the moment, it has been calculated that we are still 20% spending less on this than 10 years ago. And we know that the demands has also increased with the aging society, more inequalities and migration, climate change. So we're facing here an underinvestment. So what can we do about it? And that is what I would like to bring here on the table. It requires a bit of pioneering, but I think we need to be much more clever and smart and look at different ways where the money can potentially come from. So at Eurohealth, we looked around in the various countries and see whether we could find some inspiring case studies from how that was being taken forward. And we did find some, and I just wanted to flag up some of the areas. One area is what was actually mentioned by the lady in the previous panel discussion about, pooling budgets among different sectors. So health sector with other sectors, pooling budgets, defining common goals, but also pooling projects and see how you can make a case for investors. Money talks, as was said, and money can also be the clue for health and health policies, for cooperation, and we need to be much smarter there. Taxation, you've heard in the conference before, it's very interesting, particularly taxation on health harmful products or brown products, and how we can use the income then to invest in more health and well-being. And taxation on these harmful products also steers and nudges people into more healthy behavior. So that's definitely an interesting area, and there are good examples across the world, also Mexico and in Canada and in Europe. Working with insurance funds. In the Netherlands, for example, there are interventions that promotes health and well-being that are actually being covered now by insurance funds. Also in Germany, you have the Prevention Act, where they managed to require insurance funds to fund health promotion activities. But what we actually ought to do is navigate much better the world of finance. And that is complicated for us, health people. But there's a huge potential out there. For example, ethical banks. You have ethical banks that invest in things with social impacts and with health impacts. Like in France, there's the Finansol labels, or ethical labels. And they managed to generate in 1 year 11 billion solidarity-based savings into projects and activities that are good for health and has social outcomes. So we need to talk to these banks. What we did in your health centers, we started to draft some criteria, some health criteria that we would like to give to investors and tell them, listen, if you invest and you want to have a social impact or health impacts, you have to think of this and this and this and this. And we only started to think of these sort of criteria, but I think we need to work more on that. Okay, how do we pitch to investors? What do we want to see? There's so much money invested. I mean, and we want to see social impact investment. And what is interesting is that more and more you are hearing these sort of sounds from the financial field that, they are interested in social impact investing. So we need to be there with examples. Okay, this is what you can do. The same with all these innovative finance tools like health impact bonds, social impact bonds. I believe there is at this moment also a meeting happening between the European Investment Bank and the Sitra, the fund here in Finland on social outcome contracting. There are already some examples out there, not as well advanced so that we can say this is a good practice, but there are examples in the UK, for example, on loneliness, in Sweden on investing in health promotion at work, in Finland also on immigrants and getting them a job. And so there are examples out there, and I think it's important to see, okay, what are the potentials there? How can we work there? And then obviously the InvestEU. We heard this morning from the DG ECFIN Director General that InvestEU is there. They have dedicated this time, not last time, but for this time, a specific window for social investments. And if you read the guidelines, it's all about reducing inequalities. We want to invest for health and well-being, social impacts. They are promising a guarantee for 4 billion euros. So, fantastic. So we need to be there. So we need to build capacities of our community to be able to access these funds, to make the case, to use all of the metrics that David presented to us. Here is it. I mean, there is the evidence is there. We've heard all sorts of return on investments, €1 for 6 euros, 7 euros. So the evidence is there. We just now have to package that evidence and make propositions to the European Investment Bank and to other investors. And the problem is that we often think in too small a projects. So what we need to do is we need to work together and really make big propositions, because this is big money. But we want to see a transition, you know, we want to achieve something, so we want to think big. So we have to also put big propositions out there. So we have to, you know, to advance on this somehow. And we have, in order to make a start, we have developed a guide with all of these examples, and where we gave a glossary where we explain what it is, social impact bonds and social outcome contracting, and there's also crowdfunding, and there are all sorts of mechanisms. So I would like to invite you to look into that. But I think if we want to work and to use and implement or operationalize the economy of well-being, we can't avoid not entering the finance world and investors and see, you know, what we can get out of it. And there is a lot of, I think, capacity that is needed to further work on. Yeah.
Thank you, Caroline. You answered almost all the other questions too that I was going to pose later on this panel, but we go more into the details then. But Joseph, you already have the microphone in your hand.
Yes, I think I'm going to follow Caroline's love for well-being. So just in case, I like to reframe my comments about framing well-being into decision-making, meaning, of course, I'm behind well-being. The point, David, was that whether we need to measure well-being as such or put focus on those elements, as the Commission has been doing as well, like health, like social protection, education, and so on. So how much we want to do there. I think that's the first element. What I'm very keen to put on the table is to remind ourselves what you in Finland is telling us. I mean, if you know, Veli-Mikko Niemi, the Director General, says is a mindset, is a prisma. Let's not make the economy of well-being yet another element, another layer. It's a way, is a prisma to bring all this progress we made in so many areas together in a way, and this is going to be my theme today, we can communicate, we can change practice, because we're not changing practice. You know what I like about the economy of well-being? The economy. Do not leave anyone behind. What's beautiful about that now is that not only we don't want to leave anyone behind because we're nice people and believe in values and equity, but because it's bloody expensive. It's very expensive to leave people behind, because they really stop being productive, they are sick. Still, values are fundamental. I'm not renegating of values, please. Let's be careful here, and particularly we are videoed. But I think the economy of well-being is showing this positive cycle. But you ask us an intimate question about how do we come out of that. The reason I'm so interested is partially traumatic, I suppose, because of the work I've been doing in health, and actually David mentioned it earlier. But just let me remind you something that we all know, sort of Robert Kennedy's quote, and we're talking about that, you know. It measures, GDP measures everything, but what really matters to society. How many years is that ago? 50? Yes, 50 years. The Fitoussi Stiglitz Commission, how many years ago it is? The frameworks of the OECD. How many years we've been debating these issues, and have we done enough progress? And what we have not done enough progress? Because I think we haven't been able to do, and that's my favorite thing, the political economy, and this is where the pain comes. We had the first Tallinn conference on health systems, health and wealth, where we put together a lot of the causes, or the reasons, the rationale to invest in health systems. And we had some success. The Commission had the health and wealth and progressed quite a lot. But not as much as we would have hoped. And this is almost 10 years ago. The second, more than 10 years ago actually, the second Health and Wealth conference, then we decided to go into exactly the Prime Minister, I warned you I was going to go for you, and the Minister of Finance. Of course. And you know what we did? And I'm trying now to be practical, and I love the way that Caroline presented practical ways forward. We said, why are we not, we brought Minister of Finance and people in finance and health together around the table. I said, why are we not managing to communicate? And what we did was, let's look, what are the objectives of Minister of Finance? How do we tailor what we do in health systems to them? First, stewardship of resources, the black hole business. Demonstrate not only what value for money, demonstrate the good stewardship in healthcare, health systems, social protection, you name it, environment. There's a lot of waste. So we have to start there if we want them to pay attention. Health and economic growth. I'm now preparing for UNGA, actually with your Minister Kyuruk is coming there, a whole set of evidence in a session there around the impact of health and health systems on the economy. But what do Ministers of Finance tell us? Oh, that is very nice. Yeah, health and wealth. But listen, just come back to me with an investment program that you're going to be accountable, that is going to deliver. They're okay to wait another year, a few years. It's not just a political cycle. It is important, but you have to demonstrate to me, give me a specific program. For instance, it's very utilitarian, but for instance, invest on those who are going to have early retirement because of sickness health. Get them in the market. Show me a program that you can do that. I'm talking a very specific area. That's what I'm going to wrap it up, I promise about that. Well-being is part of their objectives. We looked at actually the objectives of Minister of Finance, and you do have well-being there. So you're accountable for well-being there. And the fact that even if the hospital ends up killing me, not treating me very well, the fact that actually I can go, if I have a heart attack now, you guys are going to treat me, it really gives me a lot of well-being. I'm very happy about that access element, regardless of whether I'm going to get value from money with my health. And of course, fiscal sustainability, and I think you guys did a great job with the silver economy. It was beautiful. We had a whole piece of work as well on the economics of healthy aging, showing that actually healthy aging can have a lot of positive feedback in the well-being of society, because I'm happy that my mom is taken care of, but also because my mom is healthy, is taking care of the neighbors, and is actually contributing economically. And I'm wrapping it here. Another aspect related with that, the Minister of Finance loved to hear as well, and we actually researched a lot, and I like to go back to your Scandinavian model during the crisis, with a lot of research during the economic crisis. And what's really interesting to see is that this negative impact on health was in a very small group of people that jumped out because of some of the cuts, because we're not clever doing the cuts, jumped out, but there were not many, because many national health services did withstand. But this small group fell out of the safety net, the welfare safety net. These are the ones that then never go back to the economy. This is the ones that go against the resilience of the whole system. And this is where the Scandinavian model is very exciting. You have been doing that, looking at the numbers. If you look at Paul Krugman's, New York Times sort of thing, it keeps saying that is in this part of the world, I know you don't like to say that, but you should be saying that in many ways, the economy of well-being is underlining the Scandinavian model, by which you invest a lot on training, you invest a lot on social protection, because that comes back to your economy, and you've been quite resilient. Of course, Finland has had problems, but understandable problems, to many of the crises. I'm really sorry. I didn't want to say a couple of things, but then I got carried away. But we're now undermine all your questions, right?
I think we very much enjoyed your intervention. Then please, Philip.
Yes, thank you very much. I'll certainly be much shorter. First of all, perhaps important for you to know what is my role in the European Commission, because even so I see some familiar faces and people I've cooperated with for a couple of years. My role now is to try to provide data, or to translate or transform data into intelligence that is useful for those that are the policy maker in the college, in the Commission. And that's for them to be able to steer their policies and their investment. So that it is my terrible role. Now I have opposite feelings after having heard Joseph before stating that perhaps data is not so important and not so necessary to act. So at least I have perhaps some economy we can make on the budget we offer and our contribution to the observatory, which is a saving, which is positive. But on the other side, I still pretend that it is even more difficult to have funds and money and sufficient manpower to ensure that we have stability in data provision for making this intelligence useful than to do the action itself, because a lot of policymakers think that it's by magic that data and information comes on their desk. So that is my personal message to the world and to the community about how information is important to it. Now, just perhaps 3 messages from what I have heard today and on the question that you kindly sent to me already. I will not answer all in details. But one thing which strikes me is that I think the economy of well-being is just already in motion in the EU. We just have not noticed it, or perhaps it was not named this way. But when I look what we did in the field of nutrition and physical activity, for instance, in the Commission with the member states, we did a lot in spite of the fact that if you look into the treaty, we don't have capacity to act. But together, because we had a common will, we achieved a number of things to try to react against obesity of children. And that's part of the well-being. That's part of this definition. Health is more than just care. So I think that's the first message and the first perhaps element of reflection I would like to share with you and have your views on also. The second, I think you say it's, and you rightly say, it seems to be very difficult to achieve. Very often because everybody understands all the necessity, but there is difficulty to coordinate between ministries and all that. Well, there is to develop new working method, and I think here the Commission is a good example of that. And perhaps for once, not patronizing, but just saying, well, look, we're trying to work differently. We're working in the Commission, the College is working differently. We have new working methods. We work before missions, so we don't work anymore one department against the other. They are objectives, and we are working together on the same objective. And it's interesting to see in the presentations by the new commissioner of how she sees the 6 priorities and how and health is in the different ones at different places. So it's really a cross-pillar exists. And I think the economy of well-being, it's exactly it. It's being in an efficacious way everywhere. And I think so. First, it's already started. Second, new methods may make it more efficient. And third, what is important is indeed, and well, you say repeatedly, money talks. I sort of agree. I was a social worker, you mentioned it, and my salary at that time was, I think, 10 times less than what my salary is today as a senior official in the Commission. So I know that money talks, and I'm pretty sure of that. And what I also have learned, and because from social work I wanted to come in the Commission because I wanted to change the world. I was very ambitious. I was 24. So I thought that's a way to do it, and I still believe in it. And in that, what we need is to steer the spending. And I think this is where, and I come back to square one, to data and health intelligence and information, this is what helps making the change occur. Because if we have not the element to convince, we cannot convince. So these are the 3 elements I thought I could put on the table. Thank you.
Thank you. That was quite a lot of thoughts for the beginning. Any reactions from the audience? We're just amazed. Well, maybe going back to that was just said about the well-being, that it has been there for a while, and I agree, at least it's been on the discussions for a long time, and then and maybe from a little bit different point of view, but I still hear a lot of frustration that it's in the discussion, it's in the objectives, but is it still happening in terms of that we've been reading these figures, that we know that using money on preventive elements of health will save you money later, but still we see that the EU budget is using about 3% on preventive measures, and the rest, apparently, when something happens, for something else. So what is the problem here? Why is we have information? Firstly, I would like to ask, are there some areas of well-being that we have actually, that we are covering okay, that we have information? And are there some areas that should be actually still, we would need more information on? And maybe the second question here is that since we have, even if we have information, why is it then not used? Because I think also in the opening speeches here, there was frustration that we know this, we have this, but it's not happening. Who would like to start?
Perhaps I start here. The first thing is you say, have we enough information? I think we have indeed more than enough information. What we don't have is a capacity to make the different systems in place working well together so that we can bring together all these information in a manner that it's even more convincing. And that's certainly one important element to mention here. So, and this is also why we are trying more and more within the Commission to try to work on interoperability of different systems. And that's very important at local, national, and EU level. That's very important.
So cooperation.
Oh, sorry.
Yes.
Oh yes, just to follow up on that point, and I would like to refer to the European semester that was also mentioned in the conference, that the European semester is a tool with loads of information, because every year there are counter reports with a quite in-depth analysis of the socioeconomic situation per country, and then there are the national reform programs by the country themselves, and then there are country-specific recommendations, and you know, it's quite a high-level process, but I think it's almost as an information overload, and the problem there is what is missing, that there is no buy-in really from the member states, but particularly from the regional and local level. It is a very high-level process. Ministries of Health and Social Affairs and Economic Affairs are on board, but no other stakeholders are really part of that process. And the European semester is, is going to look promising now, because von der Leyen has said that she would want to make it more based on the SDGs. And this has potential to track even further, okay, how are countries doing in terms of all of the SDGs, which is good for health and the various determinants of health. But if it remains a paper exercise within ministries, you know, then what will it then change? Eh? So I would like to see much more a process that's much more participatory, and where then again the health community, you know, they need to be there. They need to have the capacities to engage and make the point for health equity and well-being in that.
Philip, just in case, I'm going to reframe my reframing of my point. We do need data. We need you, and you need me, and we need the health system profiles we do with the European Commission, with the OECD and the Observatory, and there are many areas where we have serious gaps. There's no doubt about that. I think, adding very much what my colleagues are saying, I think is the capacity on the governance, is the capacity on the communication, on presenting this information, number one. The second is, we say it all the time, and here is again where we learn from the prior Finnish presidency, which is breaking the silos, is the governance across areas. I mean, actually the New Zealanders, it's worth reading the budget if you haven't done it, because it's not only that set up priorities, priorities were well-being priorities, but the way they oblige by the process of getting different ministries to work together around those. So I think that's extremely important. The work around the health in all policies, which we could say, Taru, wealth in all policies, well-being in all policies, sorry, well-being in all policies, I think is very applicable, because a lot of the emphasis, and Eva Lila is there as well, was on the intersectoral governance. And you mentioned that earlier, that perhaps you lost that a bit. But it was very much how undersecretaries work together. David taught us how to use, and you were mentioning that, intersectoral budgets controlled by the Prime Minister. So this is the things where we need to focus our energies, on these kinds of governance mechanisms that they are there, we have experience and expertise. And if you look at the New Zealanders, they're doing a lot of that. Then is the whole area of the performance of the tracking, of the focusing on outcomes. I think there's been some progress. I mean, you got the French are doing that, the British, the Welsh, a number of course, the Finns. But can we sort of name and shame a little bit more? Can we use them as accountability? So when the Prime Minister leaves office, has to be accountable against some of these measures of well-being and other areas. I think that's another way where you're saying we can advance that. And also, and related to that, of course, is the budgeting. Is the budgeting that this is the crux of the whole thing. How do we build, and going back to New Zealand, budgets around these objectives? It's very difficult to do budgets sectorally. But across sectors, even more complex. But if we don't break that one, we can continue talking about benchmarking and whatever for the rest of our lives. And this is where my frustration comes, I suppose.
Thank you. That was a very good ideas of how to improve this. Now I think there must be some reactions from the audience.
Just continuing with where you ended up, about where these kind of things should sit. I think, personally, I think that it's a good idea to have the budgets at the Prime Minister's office for certain intersectoral projects. But whether well-being or health in all policies should sit at the Prime Minister's office has been under discussion. Like in Australia, in Adelaide, they think, yeah they should. But there is another kind of aspect to think about, and it is if you give it too high of a political profile, surviving from government to government becomes perhaps more difficult. So if you have it in a sectoral ministry, the survival might be easier, and also that you should not underestimate the importance of public health knowledge or social knowledge. It's not a managerial thing. So, I mean, there are you have to weigh those things. So, on the other hand, yeah, Prime Minister's office is perfect. On the other hand, if you want a long-term survival, you need at least very strong buy-in in the sectoral ministry.
But also it's very contextual, isn't it? Everything is contextual, of course. But I mean, we've seen public health ministers dying in many countries, losing politically, disappearing when they were put in there, and others have survived very nicely. So this is another element that we always know, and when we talk about these aspects, we realize in some countries they don't need a Prime Minister's office because they have a huge connection between ministries, and they naturally work together. You don't even ask whether they work together or not. I mean, they just work together. I think it was Veli Mikonemi who was telling, I was running a session with ministers on the AMR, and I think it was when he was saying, well, AMR is not an issue to work in One Health in Finland. Am I right or wrong? I remember him saying that because we always do that. We don't need. Finland doesn't have a national action plan or One Health because it doesn't need it, because they already work together. So other countries were saying, well, how is it possible? But it's happening. It's culturally understandable. This is where we have to be always very cautious when we say, well, something works or not.
Was there one more in the back? No?
Okay, thank you. Just a comment. I'm Anni Virolainen-Julkunen from the Ministry of Health and Social Affairs and Health. Just a comment on this One Health action plan. We do have an AMR action plan, but it is written in One Health spirit, just to be precise, and emphasizing the history of doing things together. And that's the environmental ministry is involved as well.
I may have got my facts wrong, but while many countries have making an effort to put it in place now in recent years, it's something that for you was there. You obviously had one. But what I was surprised, I'm sorry, I didn't mean to mislead you, I was saying the opposite, saying that you naturally work together in this sector. and the action plan was there, but was not really what brings people together. If I misunderstood that, please do correct me, because thank you.
Now, I would like to move on to actually talk about the policy cycle. I mean, we had a lot of good things about cooperation and communication and engaging and about how to get the information more used, but are there different ways in different points of policy cycle? Like, where in planning, evaluating, like where could it be most useful? Are there different types of information on well-being that should be used at different points? And then, of course, it will be different whether it's politicians or civil servants or experts. Like, where would it be maybe the biggest impact, or where should we be aiming at? Could this be a way to maybe improve the use of information?
Well, I would just like to highlight one element of the policy cycle, and I think that we need to be much better in participatory governance. I think what we have seen out there with all of the demonstrations, the yellow vest movements, the school strikes, I mean, the citizens and people in Europe, they want to have a voice. They want to be there. And there are different approaches of engaging citizens in your policy making. You have mini juries, you have all sorts of focus groups, all sorts of ways how that can be done. And if you want to get the buy-in of people and to know what, how they see how their well-being can be increased, then we have to take them in and to take them seriously. And because loads of people are feeling that they are left behind. Perhaps they are not so left behind, but they are feeling that they are left behind. And we need to listen to them and to see, okay, you know, how can we take that on board? And if we manage to do that better, then, you know, I would logically see an economy of well-being. But yes, that is what I would like to say on your question.
Well, on the when, I think we already sort of touched the point before, in the sense, depending on which level timeliness differs. Most probably for the Commission, as you certainly know, they are very important moments, and they are first the putting in place of new college. So that is certainly an excellent period for message to be passed through the Parliament and through the pressure of the different stakeholders that have views and ideas. So that certainly is one. Another probably important moment is the moment where finance, so the multi-annual budget is discussed, and certainly that it is an important moment where ideas can be instilled, because this is when indeed we, for instance, to be concrete to you, we have been able to discuss with colleagues in different departments of the Commission, like Connect for the digital dimension, but also with DG Research for the missions that are being in place, so that issues related to health are considered in there. So these are probably important timing. And if you ask for me as a civil servant and head of unit, I mean, my time is every year when I discuss my unit management plan, so that it is the best moment for me to try to instill good ideas to my hierarchy, because this is a moment where I'm allocated staff and means to achieve results. So that's for the when.
Two reflections on that. One, adding very much what Philip was saying, which is this windows of opportunity and honeymoons of decision making. This is when the data and framing it appropriately can make a difference. This is where changing, as you say, sort of the electoral cycle, when there is a disaster as well, or when there is a big something happening as well, can actually get government to action. This is when the moment you need to act in that policy cycle. But the second aspect, I think we learn, actually working, it's been very, very useful to work with the Commission in many, many ways in this group of health system performance assessment with member states. I think data and well-being and so on will be useful when it's embedded within the decision-making. Too often in too many countries, you have agencies that they do the data. How many countries, I will not mention here, they have this wonderful agency with the best performance indicators data. They are there, they keep doing their reports, and the government keeps using the budgetary framework or whatever, which is very good as well, but no linkages on that. So how do we get this performance, this well-being information embedded in the automatic business of government? How do we get, in some countries they do that very well. I think that's one of the key elements, that because you need the data and well-being in all the elements of the cycle. At the beginning, again, the New Zealanders sort of showed you this cycle, which is a typical cycle, really. So you need that data when you set priorities, you need this data then to put the interventions, and this is why we need the data on cost effectiveness and impact, and then on monitoring and the usual cycle. But a lot of that depends on how you bring that into that, embedding that. Also, the same data needs to be presented differently to different constituencies. We're pretty lousy, all of us, and I mean, our partners push us very much in that area, by the way, in presenting data, both with Finland and the Commission here, in presenting data that serves the population, the civil society. It's the same data often, but you have to present it in different ways that aims to their different needs, or to the policymaker, or to the academic. And sometimes we just pull it all together, we release it there and hope for the best. So what I'm saying is perhaps invest more in this kind of area, because we do have some data that is magic, is wonderful, tells you to all, but we present it in ways that population doesn't understand. And often, good well-being professionals, good civil servants know how to use civil society to push policymakers. And that is when the data can be very useful, when framed, when translated for that constituency.
Thank you. So window of opportunity, tailoring, right timing. What about the audience? Do you have any?
So, Johan, yes, I think you hit the spot with the sort of customizing of the data that we're providing, and I bet it's the different situation in all of the countries. We have federal countries like Germany. In Finland, we talk a lot about these wonderful systems which provide these long-term projections, for example, for labor market and educational needs. But in fact, the central government can't tell the universities what kind of degrees they should be producing, because they have a lot of autonomy. And it's the same sort of a thing within the healthcare sectors, that there's a lot of regional autonomy. So all of these guys working at the regions pretty much are interested in what's happening in their regions. And then they need data that's supporting the decision making there. So it's a big challenge to sort of coordinate that and then try and maintain some sort of a big picture.
And in some countries even worse. Data is a very much political element that the central government is not allowed to have, and I won't mention those countries because we're videos, but there are some countries highly decentralized. I'm not talking about this country, are highly decentralized, and actually the regions will not share data with the central level because there's no trust between the two political levels. Indeed, it's a very good point.
If I may on that, talking of the still current commission, I think, and one of the work we have performed thanks to you at the observatory and to the OECD, we try to take into account that dimension, because when we started this commission, it was said, yes, you are commission officials, you are bureaucrats, you know nothing about us, and you are patronizing us. That was, in short, what was the feeling of the ambiance. When 25 years ago, when I arrived in the commission, we were considered as those that may make good work. So 25 years after, we were seen like this. And I think what was good in the mission letter we received was that we need to know better about the situation in the countries. And when we were said we need to know better, was also thinking of the regions. And this is also the reason why in the State of Health cycle that we have developed, we try to shoot two birds at the same time. One is to have a document which is per country sufficiently short to be readable by the highest possible policymakers, so those that own the decision, so to say. And second, not to do the exact same report with the exact same issues for all the countries, but to tailor and adapt and flag at the same time issues, but also positive activities in regions that could serve as example for the others. So these are two elements that we did. And the last thing I want to say, it's about, you said, communicating. And I think it's true that we are not that good in Europe at communicating. And if you think at the US, you talked about New Zealand, and they are two sentences. So a couple of words that make big change. One was, I had a dream. 3 words. and another 3 words, yes, we can. So perhaps it's not a question of numbers of words, of length of document, but to have good objective, clear objectives, and someone or some voice to carry them, and then you can change the world.
Yeah, so I'm Malea Vatanen from the permanent representative of Finland, and I'm working closely on these conclusions on economic well-being that Taru Koivisto mentioned in the beginning. And thanks for the very interesting discussion. I think very many of the elements that have been mentioned in the discussions we have already included in those conclusions that we are preparing. We are talking about cross-cutting, cross-sectoral cooperation, about this budgeting and well-being, breaking the silos, all these kind of things. So it's all there, and we hope that we will have these conclusions adopted in October. But the other thing I wanted to point out was the interesting discussion on the communication, because as Joseph put it, that we have to present the data different in different constituencies. And actually, we also need to communicate on this well-being in a very practical manner, because we also need to have like the articles in the press and also like a publicity about this issue. And this morning I read quite interesting press release on the seminar which we had on the economic well-being. And I don't think nobody took the thing into the news because it's boring. It's about blah blah blah. It's this and this. So we need something like more practical, but practical results about what happens if we invest this much and what is the result. I think that's what the journalists will pick up, these kind of practical things, and that also will help us to put pressure on the politicians to bring the message forward.
Thank you. I think this question, because I think this is a question to you also. I think we could elaborate as a last point of discussion, this practical point of how to give us some advice on how do you think, what would be the practical way of making maybe the bigger audience, the media, how can we make this well-being economy, because now we're talking about it's this and it's that and it's that, and I agree, maybe it needs to be communicated in a little bit more concise way. But I also want to add one more thing about also to this one, that because we said that we may not now know in the future what will be important. So is there something, when we make this practical point, but also something that we're maybe not aware of now that will be part of the well-being picture in the near future that we need to be prepared to also have information on?
Ulla, just...
Yes, shortly, yes. So that will be your last chance to talk here now.
But I think we need to see how we can change the mindset. We talked about paradigm change and changing the mindset, and I liked very much the system thinking, and that we need to create positive feedback loops. That can be very practical. It's about if you want to encourage more cyclists, you get more bicycles, and then you create cycle lanes, and that attracts more cyclists there. And before you know it, you have a wonderful cycling infrastructure in your city that will reduce air pollution, more physical activity, and so on. So these positive feedback loops are important to highlight. The same with sustainability in industry. I mean, at the moment we see a race to the bottom. We don't want to see a race to the bottom. We want to see how the industry is using sustainability and well-being to their advantage, that they can make profit out of it. So we want to see a race to the top. So I think this is a very positive story that I would like to hear, and that is what hopefully is attractive to a wider audience.
Perhaps to let the last word to Joseph. At the Commission level, what you can try to do, and most of you, I understand, here representative of ministries. So there is certainly one of you that is representing your country in the steering group on prevention and promotion. This is a group where we are trying to steer the spending of all Commission services regarding the issues that are linked to health and public health at large. So this is certainly the place where your good practices, or some good practice that have been mentioned along these 2 days, could be instilled and then have an opportunity for them to be developed in many other countries with EU support. So that's certainly a route to explore.
I think the risk on the communication, and for what I've seen of the Council conclusions, the Finnish presidency is dealing very nicely, is this other issue on, yesterday we had this wonderful, well, we had wonderful presentations these 2 days, but there was the one on connecting the dots. So my only worry would be, and you have that in the Council conclusions beautifully, and we need to continue on that, is showing that SDGs, social pillar, and well-being is an element to strengthen the SDGs where we have the actions, we have the targets. Is a way to give additional ammunition to the social pillar. It's not all of a sudden we don't talk about SDGs, we talk only about well-being. So we need to communicate it that way. And I think one way, adding to what's been said, which has been very good, is showing that we now, when we talk about money, is the economy stupid? Is the economy of well-being stupid? So we talk about money for well-being purposes. Go to the population and say, listen, we are putting the money into that, into the health of your children, in those parts of the society that they're falling and they're affecting our economy and they're suffering. We do that to a large extent, but showing targets, indicators, commitment around concepts of well-being that people can understand could be one way forward. Now we have to do it. But I think these two elements, but I repeat, the connecting the dots, which is totally in the Council conclusions, will be something that we need to continue doing. Otherwise, we may end up saying, no, well-being is gender, no, well-being is the environment, no, well-being that. So this is an important element in communication.
Thank you so much for this panel.
So thank you so much. Very inspiring discussions. I'm looking at the time, so we don't have very much time. But in our program, there is mentioned that the conclusions about this day or this session, which is, I think, a rather challenging one, will be made by Pasi Moisio, who is a research professor from Finnish Institute of Health and Welfare. And perhaps you may introduce yourself more in detail, because you can decide what to take up, because it's so long list what your background is. So please.
Well, thank you. Thank you. It's very interesting to come and give a conclusion. I actually wrote 3 or 4 conclusions, and I think I found out good one and witty one. I'm Pasi Moisio, like I was told here. I'm a research professor and a program director at the Finnish Institute of Health and Welfare. I'm a sociologist by training, so bashing economists comes nature to me. So, but I have to say that in some sense I'm sympathizing the economists in here, because they are not the real kind of a villains or culprits here. I think it's more about the development or big economic change. And starting my conclusion now. Obviously, people talk about well-being and economy of well-being here in different levels, from narrow to wide, or talking about economy of well-being in kind of a narrow traditional sense, and more wider, more radical sense. Let me explain to you this. First of all, many of you talk about economy of well-being in a narrow sense, meaning that it's kind of a new, novel way of talking about health and social policy, and the kind of interventions of health and social policy, meaning that trying to make the policymakers understand that they are investments to future, and they are investment for economic growth, and etc., etc. They are not just cost. But the wider concept of the economy of well-being goes back to idea, in general global development, that the economic growth doesn't anymore translate into well-being, or at least subjective happiness of the people, at least in Western countries. That didn't happen in the last 20, 40 years ago. The connection between the economic growth and the happiness, or at least well-being, subjective well-being, the link was kind of broken or lost. But of course, many reasons. You know, most of you know the thrill that once the kind of a basic material needs are met, the economic growth or living conditions don't translate directly. So we need some kind of a new goal or new target to GDP, the gross domestic production, meaning that it's producing more steel or roads don't translate into happiness anymore in that sense. And what is even worse is that many of the contemporary economic policy measures to increase or try to increase economic growth, or at least in the past 25 years, it seems that they actually increase inequality. Inequality in a sense that it already started to kind of a spillover effects on policy level, in politics and political representation, and even in sense that it transforming or even threat our kind of a Western democracy, meaning we are talking about Brexit and Trump and upsurge of populism in that sense. So kind of a more radical and thorough, wider understanding of economic of well-being is that we need to find new target for policymakers and politics in general, because the economic growth is, or GDP is not anymore kind of translate anymore in people's happiness, or at least or subjective well-being. And even worse, it seems that people are starting to protest against the policies that are aiming mainly to increase economic growth and gross domestic production. So I think in this sense, the economic of well-being is very good concept. I mean, that's a brilliant concept in a sense that it's so flexible. I mean, like here was mentioned, Josep and a few others, and as well as the ministries earlier today has mentioned, that it's kind of an umbrella concept that brings together people and policymakers and researchers who are actually trying to renew or and increase the well-being of people, having different type of tools, different size of tools. But how much time? Oh, it's running late, so I'm skipping late. So next question is that what is the concept or goal of the Finnish government, who is presidency of the at the moment? How they understand the concept of economic well-being? My kind of understanding is that they understand it more wider and more radical way than the narrow one. And perhaps it's like someone mentioned, the economic well-being is kind of a Nordic model thing. We are quite clever. We are selling the Nordic model in a nice new packet called economic well-being, and sell it to the Southerners and continental Europe. But with that wrapping and package, I think it comes more fundamental awakening an idea that we need a bigger paradigm shift in politics in general. I'm not talking about health and social policy. I'm talking about or not even just the economic policy. I'm talking about the whole politics. And I do have a kind of a wider explanation for this, and maybe I drag the whole EU in together here, meaning that I don't think the EU is innocent in this whole development that the kind of a policies that have been practiced in the past 25, 30 years, starting from the the liberation of the capital markets in the 80s, and in the 90s, the liberation of the trade in goods, and pretty much liberation or free movements of capital and goods, and et cetera, et cetera. Very famous economist and political scientist, Danny Roderick, made about 10, 15 years ago a kind of a famous theorem about the political trilemma of what about global economy. And he drew a triangle where there was globalization or global economic integration in one angle. Then you have the democracy in one angle, and then you have a nation states or sovereign states in one corner. And his bold statement was that the political trilemma comes from there, that the policymakers has to choose two of these. They cannot have them all. Meaning that you can have a deep economic integration and globalization, but you have to do it with the international corporations if you want to have it, or you have to have a global governance if you want to join that with the democracy. Because you have to choose global integration and democracy, or global integration and nation states. But it seems that the EU has been kind of picked the two of these three, has been in a way that we've been choosing economic integration and the nation states, and left the third one, meaning democracy, out of this dilemma. So I'm not going deeper into that. Please Google Dan Rodriguez, very famous bloggist and economist. I mean, he wrote more about this. But in a sense, this is not my idea. Don't blame me or draft me. I'm just quoting more famous and clever man. But this came to my mind when I'm thinking of the bigger picture of why we are here, why we are talking about the kind of a paradigm shift, and why we are talking about the economic well-being and changing the whole target for policies and policymakers. But perhaps I think new target for the whole EU, perhaps. Okay. Thank you.
Yeah, thank you so much, Pasi. Thank you, all of you. I think these discussions today have been really inspiring, and also people think that this is a difficult issue, but this is not. We have found today already several issues to take up, how to proceed, what methods and tools could be used to take this approach forward. We did data, but of course it was very well taken up, but we need different ways to use the data. We need different kinds of modeling systems. We need a different kind to combine the data, and we need to have such data which is common to different sectors, so that it's available for all and creates an opportunity to understand each other's, so that we do it. So that, for example, for Netherlands, to have these different sectors data available for the basis of planning. And a lot of very practical ways to proceed. For example, use the opportunity of sustainable development goals, because all these targets needs different perspectives. So it's not just a target 3, which is for health, for example, but we all could use that opportunity. And also all these roles which we could have there in EU semester, all these financing frameworks, how to prepare for this, and all, not just data. There were several of good examples how we could have working methods which promote also how to work together, different kind of structures, mechanisms, and Josep raised the governance issues which were developed during the health in all policies development. So there's a lot of which we could use, not just think that it's impossible, it's difficult, but there are ways to have this approach well taken into account. So I'm really hoping that this was just the first step discussion on this issue, and now we have an opportunity to continue discussion with you and our colleagues in the future, how to proceed and how to use the opportunity which is just now there with the new commission and our new government in Finland, etc. So very much thank you all of this day. And now it's time to move to the the hall. There's some refreshments, and I hope you all have some time to still continue discussions here and share the views and think about the future, the positive future for this economy of well-being. Thank you so much.